KSOS for the opportunity. My topic is anatomical and functional outcomes of a modified internal limiting membrane peel technique in a macular hole surgery, a retrospective case series. Idiopathic full thickness macular holes are a major cause of central vision loss above the age of 55 and mainly in females, the incidence being around 3.3 per thousand. Standard treatment includes pars plana vitrectomy with internal limiting membrane, which achieves an anatomical success of about 85 to 95%. The poor prognostic factors usually are longer duration of the disease, larger macular holes, and a lower macular hole index, which tend to necessitate modifications in technique for improved surgical outcomes. The different types of ILM flaps which have been utilized across decades have been the standard ILM flap. Then there can be one which is called hinged or a temporal flap. Then there is another which is called a retracting door flap and a superiorly hinged retracting door flap. They have been named according to the surgeon who have used it, and this is one which is known as the cabbage leaf flap. There are latest uproar about a few different techniques in which they have utilized peel, in which they have utilized the finesse loop and finally completed that with the cutter. So these are the few examples of videos which have been taken from the net. So with this idea in mind, we evaluated the anatomical and functional outcomes of modified ILM peel technique at our center, which was a retrospective studies interventional case series of 30 eyes from 28 consecutive patients, including 2 with bilateral disease, presenting between December 2024 and April 2025. The patients with idiopathic full thickness macular hole diagnosed on clinical examination as well as confirmed on SDOCT with a complete pre-operative and post-operative documentation were included. A minimum 1 month follow-up with SDOCT and subsequently at 3 and 6 months, and all the patients were above the age of 18 years. Patients who had undergone previous vitreoretinal surgeries had secondary macular holes due to trauma or other causes, and significant media opacities which precluded to visualization were excluded. Outcomes were analyzed on the basis of anatomical closure rates, visual outcome acuity changes, and morphometric analysis. The technique included the standard 23 or 25 gauge 3-port pars plana vitrectomy, included PVD induction, core vitrectomy, PVD induction, completion of vitrectomy, fluid air exchange at the end of the thing, and staining with brilliant blue, followed by the modified ILM peel, in which circumferential peel of around 2 to 3 disc diameters were done all around the macular hole, and the ILM was left deliberately at the edge of the macular hole without stuffing any tissue into the macular hole per se. Then the fluid air exchange was done, and a tamponade was given with 20% SF6, and a prone positioning for 3 to 7 days post-operatively was followed. Coming to the results, 65.3%, 65.3 years was the mean age in our series, and 78% were females. Majority of the patients had a duration of 6 months or less. The modified ILM technique, which we observed in our series, we had an overall closure rate of around 96.9%, which was slightly better than the success rate which has been said according to the conventional reports. This was how the type 1 closure, type 2 closure, and a persistent macular hole looked like in our cases. These are few of our representative cases during the surgery. Left side, you can see the pre-operative picture. Right side, 1 month post-operative picture of the same patient who had undergone the surgery. And all of the patients, most of them had a baseline basal diameter of more than 1000 microns, as can be evident in the slides. These are 2 cases which landed up with a persistent one was a persistent macular hole because it was a cardiac patient who was unable to lie prone, and actually following the surgery, the macular hole base diameter increased in size, if you can see to the right of the slide. And the bottom was a patient who who landed up with a type 2 closure because at baseline itself, the basal diameter was around 2000 microns. Coming to the functional outcomes, there was a modest visual improvement at 1 month follow-up, and these visual gains were maintained at 3 and 6 months, and none of them observed a drop in vision. 50% showed an improvement at 1 month, and which improved slightly to up to 71% at 3 months, and it was maintained at 6 month follow-up. The macular hole index analysis showed that the patient with a poor macular hole index, that's an MH index less than 0.5, the success rate was 91.7, which is better than 80%, which has been reported in literature. The surgical management of full thickness macular hole is often challenging. In our experience, modified ILM technique led to a complete closure and a significant visual improvement. The mechanism which is said to help in this ILM peel technique is glial migration as well as neurotropic factor released by the migrating molar cells. And chronic holes and larger macular holes are probably the ones which are going to benefit more by this technique, as was evident by the anatomical success rate in 96.9% of our series, and in a poor macular hole index group, the success rate was a better 91%. This technique demonstrated excellent safety profile with no complications intra-op or post-operatively, and may be a viable choice for chronic macular holes and shows a promising, reliable technique for future.
You have a control group for this?
No, sir. This was only a retrospective series, and all of the cases underwent the same pattern of cases, surgical technique. Sorry.
No combined procedure, all are only macular hole. In the sense, with cataract, nothing was done.
Cataract was done. Cataract was done in.
How many cases? Like,
Pardon, sir?
no, out of 38 eyes, 40
Yes,
eyes.
yes, sir.
How many underwent cataract plus vitrectomy? And
15. 15 were out of which were underwent cataract surgery. It could be phaco or manual SICS. And in such the case, I am sorry, I think I missed out that slide. There was a 100% closure rate.
Thank you.